to the subject.
Yes. Well, thank you, Father, for having me tonight. And
well, I should mention that you are a staff member of the clinic, which is named after Blessed Gianna Molla. And in 2 weeks, the son of Dr. Gianna Molla is going to be on this broadcast.
Yes. Yes, the Gianna Center in New York City with Dr. Mielnik. And, we are one of a small number of healthcare clinics that are 100% pro-life Catholic in our orientation. And it's ideally there would be many of these throughout the country. Unfortunately, there's only a handful. One here in New York City, which we recently started. One in Omaha. One in Harrisburg, Pennsylvania. In St. Louis. So they're slowly starting to crop up. But there's a real need. Gosh, if you could see and hear what we do, there's a real need and desire of the Catholic women in this country, not only the Catholic women, but just women who want health care without the sterilization, the contraception, the abortion being pushed on them. They I think, have seen through that and don't want to have a part in it and are frustrated that it's so ingrained in our American healthcare system.
Yes, and I think also an area that you've been very concerned about, women trying to have a child.
Exactly.
And sometimes that can lead, unfortunately, into behavior that's against the divine law.
Sure.
And the woman doesn't have that as an intention.
Right.
But
well, it's infertility treatments. Obviously the church is very sympathetic, and we want to be fruitful and multiply. That's straight from the Bible, and we want to help women to do that in a moral way. And unfortunately, the larger medical community sees IVF and intrauterine insemination as well as the gold standard of treatment. Unfortunately, IVF.
You must tell me. I don't know.
Sure. It stands for in vitro fertilization. That's a process whereby physicians surgically take an egg from the woman and sperm from the male. They make a conception or fertilization in a lab dish, and then instill the new embryos, these new human lives, instill them into the uterus. Several problems with this. Obviously, it goes against the church teaching the principle that new life should come from an act of love between husband and wife. So it definitely circumvents that. But it also leads to the problem of many excess embryos, new human lives, left over in storage. And that's one big problem. So what happens with these embryos? Either research sometimes is performed upon them, or they're discarded if they can't be placed inside the womb. Another problem is sometimes when they instill the embryos in the uterus, they can put too many in and get multiple pregnancies. So instead of a single baby, many times you can get twins, triplets, quadruplets, and so forth. A pregnancy like that is very high risk and very hard to carry to term. And so they recommend a selective reduction or an abortion of one or several of the unborn children.
Yes, and here you are, along with Dr. Mielnik, here in this great big city of 20 million people in the whole metropolitan area, doing this all by yourself. Tell me, do people understand and know that this opportunity is available?
Well, a lot of people don't, and that's frustrating. Also, with the recent closure of St. Vincent's Hospital, the last Catholic hospital in New York City, they may be even less aware. We were affiliated with St. Vincent's, and unfortunately that affiliation cannot continue because St. Vincent's is closing. So we're trying to get the word out that this opportunity is here in New York City, and that we want to be here for the women in this community.
Now, what are we going to do? What comes next?
Right. For the Gianna Center, or for?
Well, start with the Gianna Center. Explain to people what are we doing,
right?
And where does the name come from?
Yeah. Well, the name comes obviously from Saint Gianna Molla, and
tell them who that is.
Sure. She's a saint. She was a pediatrician in Italy in the mid-1900s, and she had several children. And for her last pregnancy, she got pregnant, and she had a fibroid tumor on her uterus. And this is a benign tumor of the uterus that ordinarily doesn't cause too many problems, but they can grow and enlarge during pregnancy, and they can cause problems with preterm delivery. They can cause problems, for instance, a difficult C-section or postpartum bleeding. Doctors recommended that she have an abortion so that they could treat her fibroid tumor to save her own life. And she said, you know what, I want to be a real mother. I want to sacrifice my life for the sake of my child. So against her doctor's recommendations, she had a C-section and had the baby. The baby was fine. And shortly, several days after her C-section, she developed peritonitis, an infection, and died from complications of that fibroid tumor of her uterus.
And those kids, those children, grow, and now one of them is going to be on our broadcast in 2 weeks.
Yes.
Pierluigi.
Yes.
And there's a fascinating story of martyrdom and witness.
Right.
And I think anyone watching this program not being aware of St. Gianna Molla or only vaguely aware of it would have to be deeply moved by that. And in a couple of weeks, 2 weeks, it's one of her sons will be on. So we'll be back in 2 minutes. This has been an exciting day because everybody's been having trouble with traffic. And as a result, I almost didn't get here, and Dr. Mielnik, our other speaker, just arrived and caught in the traffic. And we want to welcome you, Doctor. And what I've decided to do, we're going to not have the calling in part of the broadcast. We have a big subject here, a lot of things to cover. So if you're sitting there next to the telephone wanting to call up, wait till next week because Archbishop Migliore will be here from the United Nations, and he'll be our visit next week. So welcome, Dr. Mielnik. And just beforehand, you and Dr. Beiter both are medical doctors, and your particular position is what?
Well, I'm a family physician. I've done extra training in women's health, and I founded the Gianna Center here in Manhattan.